My name's Phyllis Scrivener, and I grew up in the Kansas City area. The primary doctors started looking at me probably about 3 years ago because I was having blackout spells. And so I ran through every test they could possibly do, to the point where they said, well, we just don't know. You might just have to live with this. But my primary doctor said, well, let's run an MRI on your head. And within 2 days he called me and said that you have a couple of tumors in your brain. And from that point, he recommended that I come see Dr. Pierson. And the best thing that could ever happen to me. I learned about Dr. Matthew Pierson from my primary doctor. And I'm so thankful that he led us to research, which continued to be just an amazing venture for us. He is amazing. From the first visit, we felt very comfortable with him. He was very compassionate, very informative, and we just got off to a good start. From the primary to Dr. Pierson to the eye specialist, it all just rolled so smoothly. And then just being here at the hospital, it was the most amazing experience because there was not one cranky nurse, therapist at all. I thought, well, ICU went great. That's wonderful. They're all great people. Then I got to the hospital and it's like, wow, I didn't think it could get any better. And then I got blessed enough to get to stay at Research for Rehab. And that was an answered prayer. My experience with Dr. Pierson from the very beginning was incredible. We felt an immediate bond with him. He had compassion. He had knowledge. We felt he was really sweet because he told me that he would treat me like I was his mother. And what he would do for his mother is what he would do for me. What a security that was, to have a surgeon tell you that's how important. And he said, I'm not going to rush through anything. He said, I'm going to take my time, and we're going to get through this. And I just give Dr. Pierson the credit for the extra time he took, the care, the compassion, and just everything he's done for me.
Phyllis came to me for what's called a tuberculum meningioma. This is a typically benign tumor that grows from the base of the skull. These tumors often present with gradual vision loss, which is the main symptom that Phyllis had. I like to sit down with the patients and their families and discuss what their condition is, what the expectations are, and available treatment options ranging from simple observation to surgical interventions. And if we do pursue surgical intervention, I like to talk about what my skill set is and what else might suit the patient and their family and their individual needs. Over the past 6 months, Phyllis is the second patient that I've operated on for this condition through the nose. And throughout the course of training and fellowship, there have been multiple patients that we've seen in surgery and in the office as well. The classic way to remove these tumors is the transcranial route. Typically there can be a longer hospital stay, but the main benefit that I find is that taking these tumors out through the nose results in decompressing the optic apparatus early, and Phyllis's vision is the thing that was most important for me to keep safe. From a cosmetic standpoint, I prefer the through the nose route because there's no incision other than some nasal stuffiness that's temporary. There's no big incision on the scalp and no bad haircut. I've seen Phyllis in the office, and she's been doing wonderfully. She's left rehab and gone home and is doing everything on her own, and she told me that her vision is getting better, and that was the ultimate goal and whole reason for doing all of this.